wandering around on the internet late at night looking, trying to figure out, this whole thing, and then on top of that, you got to be private about it because you don't want anybody think that you're creepy, just because you want to change your size, and then the other crazy stuff is that, and somebody would be calling me during this time, actually. So the other crazy thing is that, guys go out there and they have things done. And what really happens is they can get botched or something crazy like that. You always hear about the bad stuff, and stuff like that. So today, what we're going to actually talk about is what actually happens during girth procedure. Let's get down to the real part of what really happens. So start off. I'm Dr. Melvin Fussell. I'm a board certified urologist for over 20 years. Not 10, not 15, over 20. So I've been doing this for a couple of decades. And the thing is, I'm that doctor who does, prostate cancer surgery, kidney cancer. I've been on the renal transplant team. I've been managing patients in intensive care unit. I'm handling stuff that comes to the emergency room. I always tell guys, if you did something stupid, like shot yourself in the penis, and you go to the emergency room and they say, well, you're going to have to go to surgery, I'm the surgeon that they call. All right. So I'm that kind of guy. I'm a urologist. Now, the thing is that why is that important? If somebody's going to do something to your junk down below, then you might as well start with a specialist. That'd be me. So the thing is that that's what I do. And it took years and years to become a urologist. So, my pathway wasn't direct. I was an electrical engineer and worked doing design engineering. Then I became a bioengineer. Then I decided to go to medical school, then surgery and all this other kind of stuff. So here I am, just making penises bigger. All that to just make penises bigger. Wow. So here we go. So now the thing about it is what actually happens during a girth procedure. And I want to welcome everybody aboard. We just hit 12 o'clock. So I know other people are coming on board. And I can tell you that, you can go and actually go to our website, which is UroHard.com. That's UROHARD.com. Do we have that shown up there? Or yes. Okay. So UroHard.com, or you can call our office 478-225-9324. But here's the cool thing. We got a little thing on our website now. It's down in the bottom corner, like the right-hand side, and it's a little green button that shows a phone where you can actually interact with our website. You click on this and actually can ask questions about male enhancement. Ask questions about Dr. Fussell and his credentials. Ask questions about where we're located and the price of our procedure and all this other kind of stuff. All this stuff is actually right there. All you got to do is click and ask. So we set it up where you can actually chat. So if you're in a private setting where you don't want anybody to hear what's being said, you can actually type it in. Or you can just talk and it will actually talk back to you. Imagine that. That's cool as all out. So go to our website and just ask the website questions, And then the thing about it is that if you want to jump in more in depth, then you set up a phone consultation and ask us directly questions. So a lot of times you'll end up with me on the phone answer your questions, and I'll help you dive deeply into what's going on. So what we're talking about today still kind of falls under this whole thing of size matters. And this is all about real talk. I'm going to tell you now, this is an adult conversation. If you're under 18 years old, if you're 18 years old, younger, this conversation not for you. Get off. This ain't for you. This is for adults. This is an adult conversation. So I'm sorry. If you're too young, get off. Now, the thing is that what actually happens during a girth procedure? Most men have absolutely no idea. All right. Hey, I can't see that. You're trying to show it to me. You got to move it over. Cameras are blocking. Oh, My nurse has always told me, she said, remind viewers that that we're trying to destigmatize male enhancement and ask them to like and share our live so we can reach out to more people. And I kind of touched on that. So now got that part out of the way. Now the thing is that most men absolutely have no idea what actually happens during a girth enhancement procedure. They imagine that it's painful, it's complicated, it requires weeks of recovery. But the reality might actually surprise you. All right. So do me a favor. I want you to kind of put in the chat so you can interact during this live talk. What do you really think happens during a girth procedure? Now, I can tell you that when we say girth procedure, there's several different types of girth procedures. And because I'm a surgeon, and I got off into this whole thing of cosmetic urology, I can tell you there are basically three ways to increase the size of the penis. You can do an implant, all right, you can do a fat transfer, or you can do a filler procedure. Now, as a surgeon, I've done them all right? And I can kind of touch on the different ones that are out there, as far as the different types. I won't talk about individuals because I don't want to step on anybody's toes, but I can talk about an implant. Yes, you can actually go in there and put an implant in. Now, I don't want you to confuse this with a penile prosthesis because that's totally different. Now, just so that we can get this whole idea about penile prosthesis out of the way. A penile prosthesis is what we use when a guy cannot get erection. We're talking about an IPP, inflatable penile prosthesis, IPP. This is a guy who everything is filled for one reason or another. He cannot get erections anymore. So you actually put in there something that can be inflated. So you actually can pump the penis up where you go pump, 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 and now it's a full erection. And then you push it and the fluid goes back into a reservoir. And now the penis is back down. So we usually place the pump in a certain places down in the scrotal sac. A guy reaches down, he feels for the button, he presses it, and he pumps it up just like a balloon. And now that penis is in an erect state until he lets it down. Inflatable penile prostheses work great. All right. Do they have their problems? Yes, they do have problems because nothing's perfect, of course. But if you decide to get a penile prosthesis for whatever reason, know two things. You're going to lose some size as far as girth, and you're going to lose some length. And that's because when you put the prosthesis inside of the penis, you can only make it so big. If you oversize it, it could actually erode through the skin, and now you got an infection, and now you got to pull it out, things of that sort. So it has to be placed correctly. So sizing it to the penis is very important. So the surgeon realizes that, they have to take measurements during the procedure and say, I have to have a prosthesis at this size. Or, if they need something longer, they can put more extenders in there and all this other kind of stuff. But this has been going on for years as far as penile prosthesis. So the thing is that do they work? Yes, they do. Do they change the game? Yes, it does. If you're a guy who could not get an erection at all, and now you got a penile prosthesis where you can pump it up, you're back in the game. And if you lose size, then you can actually have girth enhancement done to help regain the size that you lost. Now, inflatable penile prosthesis are for erections. That's different from what we're talking about. What we're talking about today is girth procedures, like putting in basically implant under their skin to make the penis bigger. All right. Now, that procedure is a surgical procedure. We actually have to make an incision in the skin and then tunnel the implant into the correct place, sew it down. The patient has to heal. Do they work? Yes, they do. But that's an implant. The next one is fat transfer. That's where you actually take fat from the patient's body. So we take your fat and we morselize it. You said, what do you mean morselize it? Basically, we break it up so we can actually inject it. All right. You can't inject a big fat globule. You got to break it down to something that's injectable. And now you inject it actually under the skin. And now the thing is now you got to wait for that fat and hope that fat is going to actually take. And that what I mean by take, meaning that it has to develop its own vascular system, just like any cell that's in the body, and hopefully it'll survive. If it doesn't survive, what happens is the fat liquefies and the body reabsorbs it. So that's fat transfer. Now you got this big old fat penis down there, and all this fat's in there. And yes, if you lose weight, your penis lose weight. If you gain weight, your penis gains weight. So the thing is that yes, your penis can lose size, it can gain size, all about how much you're controlling your weight and things of that sort. So yes, if you had a fat transfer and you got on one of those GLP-1s or whatever, semaglutide or something like that, or Mounjaro or whatever, because I'm trying to lose weight, yeah, your penis is going to get smaller. It's going to happen because it's just fat. And it doesn't have the same consistency as the normal penis. It feels like a big fat penis, and it's squishy fat, But the thing is, you got more size because you want to decrease your girth. All right. The third thing is a filler. All right. You can actually inject a filler. Now, there's so many different fillers out there. There are fillers out there that, women have been doing fillers in their lips and all these other places and stuff like that for years. And the fillers last for a certain amount of time. And then after that, they're reabsorbed by the body. You got to go back and get a second injection. That's what we see. Fillers are more common in the face and stuff like that. But then we start doing fillers in the penis. But here's the difference. Is that when we inject our filler formula, which is patented, using only FDA-approved products, our filler gets the body to create its own collagen. It's a biostimulant. So now at this point, you're creating your own tissue. So our filler actually goes away. What you got left is your natural collagen tissue. All right? So did anybody put anything in the chat about what they actually think that happens during a girth procedure? I don't know. Did we have any comments yet?
Someone said PRP injections, and someone said, what about Alloderm?
Okay, so they asked about Alloderm. They asked about PRP. I can tell you that PRP is totally different. PRP does not increase your girth, plasma-rich platelets. All right. So the thing is that what is PRP? Other people are like, what is PRP? PRP. Basically, with PRP, what they're doing is that's where you take the healing factors from somebody's bloodstream. And we use PRP all the time because we do male enhancement and erectile dysfunction. Now, what we tell people is that when you do PRP, basically what we're doing is taking the healing factors from your bloodstream. All right. We concentrate them down. We remove all the red blood cells, white blood cells, and now we have this yellow serum. And that is your healing factors. So now we can take your healing factors and place them back into the penis, or you can put it into the joint, or you can put it into the socket of the tooth, or you can put it in the spine, or you could put it, here or there. You could put it into a wound that's trying to heal. You're like, wow, you can put that stuff everywhere. Why? Yes. Because all I did was take you and give you back you. I can inject you into your body anywhere, everywhere to help it heal. PRP is excellent. It's something that, hey, we have jumped on top of. And the thing is that because it's something from your body, the insurance companies cannot monetize this. They're trying to figure out, how can we grab hold of this? But because it is something that is yours, all we did was take it, spin it down, and give it back to you. That's why PRP is usually paid for out of pocket. It's not covered by insurances. But is it excellent? You got to ask yourself, are you excellent? Because all we did was give you back you. And you're excellent. What's the best way to heal? Is heal thyself, right? Have a little prayer. Heal thyself. All right. So that's what PRP. Alloderm, I don't have much to say about Alloderm, but it's not going to be permanent. So the thing is that we're way past Alloderm. All right, why men ask about girth procedures? All right, first of all, because men want more confidence. This whole thing with increasing your size goes parallel with increasing your confidence. As size goes up, confidence goes up. I can tell you, you can graft it out. If it's something tangible that you can put your finger on, that confidence, you can graft it right along with the size of the penis. And you'll see both of them going up and up and up. All right, curiosity about how it works. That's why men are asking about this, because they're curious about how does this really work? Can I get this done? All right. And then the whole thing that gets them is that they have a fear of pain or complications, because you've heard so much crap out there, all these misconceptions, and all these things. That's why I'm doing these talks, because I'm trying to destigmatize all this stuff that's out there. So you want to get it from, I guess, the horse's mouth, so to speak, an actual surgeon. Yep, that's me. So the thing is what we're trying to do is give you the real story on what happens. All right. And then all these misconceptions that guys get, from being on the internet and things like that, and watching porn and all this other kind of stuff. You're seeing these guys who, are hung down to their kneecap, and you don't realize that they had enhancement in most cases. And now, they're on there and they're doing these shows and whatever. You say, well, how do you know they had enhancement? Because I've enhanced some of them. I know for a fact. All right. A lot of men are interested in enhancement, but they're nervous because they don't understand the process. And that's why we're doing this whole talk. If there are other questions that are popping up, let me know.
Where do I go, and what's the biggest I can get?
Well, where you want to go is you want to go come see us. All right. Starting out, just go to our website. That's UroHard.com. That's UroHard.com. You're welcome to come to our office. It's right up top. Right up top. So you can go to our office. You can call our office 478. You can do a consultation. And then the thing is that if you just say, I'm just curious, go interact with my website. You can actually talk to my website. All right. And ask it questions. It's still going through beta testing. So if you want to make sure your questions are clear and concise, just pick up the phone and call us. All right. But our AI system will actually talk to you or give you a chat and answer questions. So interact with us. And at that point, if you say, hey, I want an appointment, it can help you out with that too.
What's the biggest it can get?
Oh, the biggest you can get. Well, actually, ain't no limit. That's kind of scary, but it's true. But the thing about it is that, is there a point of diminishing returns? If you've been on any of my other talks, you'll realize that yes, there is a point of diminishing returns. You say, well, what do you mean, Doc? The problem becomes is that that's all she can handle. Can I sum it up any other way? The thing is that once you start getting up over 6.5 inches in girth, then most women can't handle your size. And I always do this. So yeah, for those who've seen me do it, I reach in for my wallet because I need you to understand. Ooh, I'm gonna pull out $100 bill. How about that? Let's get real. Boom. All right, now $100 bill is 6 inches, just like a $1 bill from end to end. All right, so this is like a measuring stick. If I take this 6 inches and I roll it up, all right, I'm trying to give you all this visualization. That's what 6 inches of girth looks like. And most guys out there who are within normal limits are not even close to this size. But when you start getting to 6.5 inches, now you're at a point where a lot of women cannot accept your size. Once you get up into 7, oh, you're stretching them. Trust me. And what we talked about this, all the nerves are located within the walls of the vagina. So if you're walking around and you're swinging at this level, then you realize that, hey, you're in the 90th percentile, and all the other guys sitting at the table, they ain't your size. All right. And then the guys are going to ask you, did you go see Dr. Fussell? And just go ahead on and say, yes, I did. UroHard for men, horns up. That's right, because everybody wants a bigger horn. So yes, we bring guys up to that size. But do I have guys bigger than 6.5? Yeah. Yeah, I got some guys out there. I actually ask them, are you sure you want to be much bigger than this? And it just depends on your relationship. Like I've said this many times. I had one guy tell me that, his wife had all vaginal births. She's had 4 children. She's got copious hips. Basically, what we're saying is she's got a very copious vagina. After 4 vaginal births, she's got size that didn't snap back. And if you ever watch a baby being born, I mean, the head coming through the birth canal, it's amazing. When I watched my son being born, I was like, man, it ain't gonna never be the same. It took years for that thing to snap back. But I can tell you that, yes, it does try to snap back. But if you've had 4 kids, then yeah, you're probably bigger than the average. And if you take more size to, actually become enjoyable, then yeah, then maybe you might want your husband bigger than 6.5. That's totally up to you in your bedroom.
Is it covered by insurance? And is there any oils that someone can use? I think that means topical oils.
Okay, I can tell you right now, our procedures are considered cosmetic. And the question was, is it covered by insurance? No, we do not accept insurance, but we do offer financing. So, when you go look at it, and I know this question is going to come up, how much does it cost? When you go look at our procedure, if you're talking about the girth procedure, we always say, let's talk about the anatomy of the penis. The penis has a shaft with the head on top. All right, shaft with the head on top. If you just want to make the shaft bigger, then that's $7,950. If you just want to make the head bigger, that's $3,500. But if you make the shaft and the head bigger at the same time, then that's $9,950. So the thing is that basically, if you need financing, we have financing for good credit, bad credit, no credit. So you don't think that, don't think that it's out of reach. Like, man, I can't afford that. Yeah, we can actually help you out. You come in, you do $1,000 down, and we can work on your financing. Of course, the better your credit is, the better we can help you out as far as interest rates and stuff like that. But is there anybody that we can't help? No, we can get you in the game. The thing is, don't suffer in silence and don't let the numbers trick you. You can have something done. You can get it done immediately. All right. So this whole thing with male enhancement, a lot of guys want this procedure, but they're nervous because they didn't understand the process. So here, let me explain what happens before you ever have a procedure done. The first thing that's going to happen with us, and I got to speak for my office, is that you're going to have a phone consultation, and it's free. All you got to do is pick up the phone and call us. And when we talk about this phone consultation, we're going to actually break it down where you can understand what's going on and answer all your questions and help you understand. Now, the thing is that because we do male enhancement and erectile dysfunction, I always got to understand if a guy wants to be bigger, longer, or harder. Bigger is increasing girth, longer is increasing length, harder is erectile dysfunction. If you're calling and your concern is just erectile dysfunction and you have no desire to be bigger or longer, then that becomes a doctor's appointment, because now we're jumping into a deep conversation of why you have erectile dysfunction. All right. And for a lot of guys, when they say erectile dysfunction, that pendulum can swing from the pills aren't working as well anymore to I can get an erection, but it's not quite the same. It don't stay as hard as it used to, or I come too fast, or I can't get an erection at all. So I really got to zoom in. And then the 3 big problems is it a blood flow problem? Is it a nerve problem? Is it a desire problem? So yes, our erectile dysfunction consultations is a $200 appointment. Basically, you've put $50 down to lock in your date. your consultation, and then from there you can come in, or you can actually do it over the phone after you pay your residual balance. And then at that point, usually you're doing your ED consultation directly with me. I'm the guy you see when the pills don't work anymore. All this stuff that you're seeing on TV and all this other kind of stuff. You talk about the Viagra, the Cialis, what's that other new one out now? What's started with the R, whatever. I'm trying to say it, but I always say it wrong. But anyway, you know what I'm talking about. You know what I'm talking about. So, all that stuff that's out there, what happens when it doesn't work? And guys always say, hey, man, it don't work. It don't work for me. Or, it doesn't work anymore. Am I dead in the water? Is it over? No, we can do something about it. And if we should make your penis bigger, and you say, Doc, I can't get erections, but you make my penis bigger, then we're going to waive the consultation fee because I already know you at this point. We're going to go straight into what do we got to do to help you have good erections, because it makes no sense to have a big penis if it don't work, right? So, that's why we cover all the bases. All right. So you start off with a phone consultation, and then we're going to go into your medical history. Why is medical history important? Because the thing is, there's so many things that can be going on with a guy. I want to know if you got diabetes. Diabetes is huge. That's a big knock right there. Diabetes, hypertension, increased cholesterol, all those affect blood flow, things of that sort. If you're a diabetic and your diabetes is poorly controlled, then I can tell you now that we're going to have to make some changes before we even do your male enhancement. If you come to me and your A1C is greater than 8, and don't tell me you don't know what A1C is. If you're diabetic and you don't know what A1C is, then that tells me that you don't know how to play the game and you're going to lose. So you need to know. You said, well, Doc, stop being so hard on me. What do I need to do? Just pick up your phone and say, Siri, what's A1C? I know that works for an iPhone. And it'll just start telling you. Or you can go to Chat GPT or AI and just say, what is A1C? You can put it in voice mode and it'll just tell you. You can know within minutes. What is A1C? It is so important to know your glycosylated hemoglobin. So yes, I got to start with the medical history. I'm going to ask you that. I'm going to ask you, how good are your erections? Are you taking things for your erections? Well, I want to know because we want to establish where you are before we ever start doing the male enhancement. I want to know, how's your libido? How's your desire? I want to know, do you have heart problems? And because we are using a filler, which requires an injection, are you on any blood thinners? So all that stuff is important to me. That's why I need a medical history. And then the whole thing is having good expectations. All right. Because a lot of guys think that I can take something that's imperfect and make it perfect. So let me tell you this. And I say this to guys. The penis is like fingers and toes. There are no perfect fingers and there are no perfect toes. All right. We can use this as a reel. The penis is like fingers and toes. So the thing is that because there are no perfect fingers, that people don't even like the fingers. There are people that don't even like their feet. I don't like my feet. I'm not wearing open toe shoes and whatever because I don't like my feet. But I can tell you one thing, there's not a perfect penis out there. A lot of guys have circumcisions when they're born, and that's the majority of us. And they don't realize their circumcision was jacked, completely jacked up. But that's all they got. And they ain't got nobody to compare it to. So they're thinking that, hey, I'm good, until they actually run into a urologist that's seen thousands and thousands and thousands of penises. And you say, hey, man, they jacked up your circumcision. So now you need to take something that's imperfect and make it perfect. Not going to happen. I can make it bigger, but I can't make it perfect. Understand there's so many variations out there as far as the penis goes, and there's no perfect penis. So don't get confused. All right. So all those questions, I'm basically trying to determine if you're even a good candidate for what we're trying to do. And I want men to have realistic expectations and make sure the procedure is right for you. Because the thing is that when you do our procedure, we're very strict about how we want you to take care of it, things that we want you to do. And we tell you from the start, if you're not going to follow the directions, don't have our procedure. Just go somewhere else. All right? Because we are all about outcomes. Now, the next thing that happens is your actual procedure day. That means you take care of all your finances, you put your down payment. We actually gave you a date and you actually came in. Now you're here. This is your date. You're sitting there in the waiting room. You're a little antsy. You're like, I saw this guy on social media, and I can't believe I flew from all over the country because we got guys coming from California, New York, Miami. I mean, they're flying in from all over the country, and they come right here to our office in Warner Robins, Georgia. They'll fly into Atlanta. They'll catch the Groom, or which is a transportation system, or they'll rent a car. They'll come down. I'm like, give me 3 hours and they'll come down, and during that 3 hour period, they're going to get a chance to sit down and talk and answer all their questions and all this other kind of stuff. That's procedure day. And most guys are sitting there and they're a little nervous because you're like, hey, I saw this guy on social media and now I'm going to trust him to work on the family jewel, my junk. I'm going to trust this guy with my junk. Is he going to mess me up? Could something go wrong? Am I going to be on botched or something like that? But the thing is that what I do is I sit there and I answer questions till they run out of questions.
It's a good time to answer a question. Are there any side effects?
Side
Not
effects.
botched, yeah.
Side effects. Somebody asked the question, are there any side effects? As far as healing and stuff like that, there are no side effects. But what we do see is guys that don't follow our directions. And they don't do the things that we ask them to do because we always tell them about protecting the skin, things of that sort. We tell them about how we want you to take care of it and how to massage it. Is it possible that you might have an area that's not as big as the other area? That doesn't usually happen. But usually when we see that, it's because a guy did something incorrectly. All right. And then we fix that. So this procedure, we've done over 19,000 cases and guys are doing great. We're doing cases from all over the country. I actually got guys that are coming from Uganda. I got guys flying in from the Virgin Islands, so we got guys flying in from Africa and all this other kind of stuff right here to Warner Robins, Georgia. We're putting it on the map. Trust me. All right. Now, let's actually talk about what happens. When you actually come in and we've done our talk, then you actually get what we actually tell people that this girth procedure, listen closely, is no surgery, no cutting, is painless. Go home same day, back to work the next day, and it's permanent for life. You're like, man, that's too good to be true. How could that possibly be true? That's just too good to be true. Well, the reason that is true is because we do a penile block. So you don't feel what we're doing or anything. Guys actually fall asleep. And when we do our procedure, we do it here in our Warner Robins office. We do have a second location down in Jacksonville. But when you come to our Warner Robins office, you're having it done in our private operating room. Yes, yes, yes. Let me take a bow. I have a private operating room. That's right. Actually, a surgical center. We can do anything here that they do in the hospital. You just got to be able to walk away. So yes, we do have a surgery center. So now you come here and you get it done in our actual private operating room. The procedure itself takes maybe about 40 to 60 minutes, but actually it's less than that. That's just your time on the table. Expect to be with us for about 3 hours because during that 3 hour time, that's when, we're going to talk to you and make sure everything's fine. We're not rushing. You don't come down here to rush. I mean, this is masterpiece type work. So we're not rushing your procedure. And the patient is awake and comfortable. And I say that unless you just want to take a nap. I personally take it as a compliment when guys fall asleep during our procedure. Because in my private operating room, when we go down there, you got to remember now, I've been taking out kidneys and, doing prostate cancer surgery. So male enhancement, man, this is simple. turn on some jazz music, relax back. We got this. This is artwork for us. I mean, it's like coloring compared to, taking a kidney out. So the guys there is chill. He once we do a penile block and it sets up, they don't feel anything I'm doing. Some guys have to ask me, Doc, have you started yet? And I'm like, I'm halfway through the procedure. So I tell them, I say, hey, if you want to take a nap, take a nap. Now, if you don't believe me, go to my Instagram page and we actually have a video because this guy was snoring his butt off during the procedure. So you can actually listen to a guy snoring, during the procedure. All right. So he was so knocked out, so comfortable. And I consider it a compliment when guys take a nap on the table because you just met me. You got to trust me. You got to know that I know what I'm doing. And that's the reason the majority of the guys actually take a nap during the procedure. Now, the enhancement process. All right. Now, when we do this, we use a medical filler. All right. That is a biostimulant. We inject it in layers under the skin. All right. It's designed to increase your girth because being a biostimulant, it increases your collagen. All right. So this is not a device that I put under there or anything like that. And because it's all natural tissue, not a device, not fat from somewhere else in your tissue, you get a natural appearance because this is just your tissue. You can scratch it, you can cut it, it bleeds. You can gain weight, lose weight, same size. Once I make you bigger, that's your size for life. All right. Now, recovery afterwards. All right. We tell you that patient goes home same day. All right. After you have this procedure done, you get to go home. Remember, I said no surgery, no cutting, it's painless. Go home same day, back at work the next day, and it's permanent for life. So you get to go home same day. All right. And it's not like, and you can go back to work the next day. There might be a little bit of mild swelling. Why? Because that's from the small needle sticks. All right. And then it's a short recovery window. We're talking about give us 40 days, 40 nights. And other guys be like, 40 days, 40 nights. I can't believe you want that much time. I can't go that long without sex. I'm like, man, listen, give me 40 days. We give you back a lifetime. All right. It's as simple as that. We change the game. Follow-up instructions. You have to stay in contact with us. And we need pictures every 3 days. You're like, Doc, why do you want pictures every 3 days? Because we are so focused about results. That's all we care about. And we want to make sure everything's going well. So you get our cell phone numbers, we got your cell phone number, and we follow you all the way through your healing process. So this is not a wham, bam, thank you, ma'am type of procedure. When you get it done, we follow you until you heal up. After that time, then yeah, you can get back to having sex. All right. Now, typical results that we expect. We tell guys to expect that you're going to pick up 3¼ to inch in girth. All right. But that's a minimum. We have guys that pick up 1.5 to 2 inches in girth. All right. So yeah, if you come in here, you say, Doc, I'm about 5. Well, yeah, you're going to be about 6.5, 7 once we're done for those guys that really pick up that size. Why? Because we have special things that are trade secrets that we do for our patients that really help them pack on collagen. So our guys are really picking up size. All right. So yes, we do change your size. We change it for life. And yes, you're part of the big boy club. Come get this BDL, right? Now, what does it do with your confidence? Your confidence is going to be off the charts because now we changed it. If you ever question your size, or if you ever said, that's all you got, don't ever let it happen again. We got you. Now, what are the biggest misconceptions? It's that it's extremely painful. And the recovery takes weeks. Well, yeah, it's 40 days, but that's during that period where you're actually developing all the collagen. So we don't want you doing anything, and we're very strict about that time. And then there's another misconception that it looks unnatural. No, this is your natural tissue. All right. It's not a filler. It's not an implant. This is your natural tissue. Now, most of this stuff that's out there is because guys get confused. Now, I can tell you, I got to throw this out there that if you're just joining us, I'm looking up at the sign that reminds me that we're trying to destigmatize male enhancement, and we ask that you like and share our live. So, guys, if you ever thought about it, or hey, ladies, if you got a husband out there or a significant other, and you say, hey, man, I wouldn't mind if you were a little bit bigger. Hey, send them to us or send them this live show. All right. What's the biggest? Now, let me ask the people. What's the biggest concern you you'd have about a procedure like this? If you've been listening, kind of put in the chat. What's your biggest concerns, so I can address some of these things now. What would you want someone like what would you want something like this done in a hospital or in an office setting? All right, put it in the chat. I want to know, because when you come see us, we're doing it in our private operating room. Hey, Lisa, let me know if there are any questions in the chat.
We're good right now.
Okay. Now, let me ask you also to put this in the chat. Do you think confidence changes how someone carries himself? All right. I can tell you that I've seen it. I've seen guys' confidence go off the chart. Now, they're approaching, females differently, or their significant other differently, because now they're more confident. I can tell you there are guys out there who confidence has been shattered because they were concerned about their size, or they would not even get into a relationship because they were concerned that, hey, I can't make it. I can't satisfy my significant other. Well, understand this. We can do something about it. Where can you go where a doctor can increase your size and improve your erections? I'm listening. Where can you go? Well, I can tell you one place that you can go, and that's to come and see me. I'm Dr. Melvin Fussell, board certified urologist, and we are UroHard for Men. We're located here in Warner Robins, Georgia. You see our phone number and website up top, UroHard.com, phone number 478-225-9324. Now, I'm kind of wrapping up this talk because this talk was pretty straightforward. And basically what we talked about today is what actually happens during a girth procedure, because, guys want to know. And this is a lot of what I discuss when guys are coming in for consultations and stuff like that. So if you don't decide to put anything in the chat, understand this. You can go to our website and you can chat with our website. You can call our office and you can chat directly with us. All right. And help you make a decision about what do you want to do and change the game. You only live once. So if there are no more questions at this time, I'm expecting you to go ahead on and shoot us some questions. So reach out to us. Let us know. Until then, horns up.
Someone said, can both be done an implant and filler?
I already ended. I'm still going? Oh, wow. Can both be done implant and filler? Yes, but, all right, when you start talking about an implant, because I already ended the show, but I'm going to answer this question because it came in right at the end. If you're talking about inflatable penile prosthesis, yes, definitely yes. I do those all the time. I've done several. Guys do well, all right? And it's an excellent thing to be able to have an implant and inflatable penile prosthesis. And now you got this big penis that can stay up as long as you want. You can be the man all night if you want to. Now, if you have an implant that they put under the skin, then that becomes a little bit touchier. Can it be done? Yes, it can. But it needs to be done in the right hands, because you want to make sure you don't get any infection. You need to understand exactly what type of prosthesis is under the skin, things of that sort. So you need to be very careful. Now, In a surgeon's hands like mine, yes, it can be done. You just want to make sure that it's understood what you have and what's going on before anything's done. All right. So if there are not any other questions, we ended the show, but somebody threw a quick question in at the end because I'm about to throw these horns up and bring this thing to the end. Hey, once again, guys, I appreciate you. Thank you for joining us. UroHard for Men. Horns up.